name is Janelle Wessels, and I will be doing the skills video of patient education, prenatal education, focusing on precautions. The first thing I will be discussing is talking about foods that should be avoided during pregnancy. The first being any unwashed or pre-cut fruits and vegetables, unpasteurized dairy, deli meat, and certain cheeses. This is because it can lead to listeriosis, which can cause a miscarriage. Unwashed fruit and vegetables and undercooked meat can lead to toxoplasmosis, and that can lead to fetal blindness and fetal brain damage. Undercooked meat and raw or undercooked eggs can lead to salmonella poisoning, which can lead to or can cause a miscarriage. You also want to avoid eating any fish that contains high levels of mercury, and this is because this can affect the nervous system of the baby. You are allowed to take some certain over-the-counter medications. There are certain medications that are deemed safe to take during pregnancy. You might want to consult your doctor, though, if you are planning on taking them, but some of these can include acetaminophen or Tylenol, Benadryl, Claritin, Zyrtec, and docusate sodium or Colis. With this being said, it is best to consult your doctor, like I said, and you want to try and avoid taking any over-the-counter medications, primarily in the first trimester, because this is when the baby or the fetus is at the highest risk of developing like any problems. With that being said, prenatal supplements and folic acid are actually strongly recommended to take throughout your entire pregnancy. Sometimes if you struggle to gain weight during your pregnancy, there are protein powders that are safe, like Boost, and that's okay to take during pregnancy. There are some medications that we absolutely say no. They're actually contraindicated during pregnancy, and that would include any teratogenic drugs. That's because it can cause severe birth defects and miscarriage. Some of those drugs can include any epileptic medication, retinoid medication, ACE inhibitors, ARBs, lithium, oral contraceptives, and warfarin. 3 common environmental exposures that you want to avoid would include experiencing high levels amount of heat, and this is something like hot tubs or saunas, and that is because it can cause severe neural tube defects in the fetus. The next thing that you want to avoid is going to be cat litter boxes, because that can expose you to toxoplasmosis, which again can lead to fetal blindness and brain damage, but it can also lead to a stillbirth. Finally, you want to avoid radiation, like high doses of X-ray, and this is because that can lead to a miscarriage. Alcohol, tobacco, and substances need to be absolutely avoided during your pregnancy. Alcohol can lead to fetal alcohol syndrome, and that can cause like growth abnormalities, mental disabilities, and abnormal facial features. Tobacco cessation, or tobacco can have tobacco has harmful chemicals and nicotine, and the nicotine can cause permanent damage to the baby's lungs and brain. Both alcohol and tobacco can also cause vasoconstriction, so that means that it lowers the amount of oxygen that the baby is receiving, and it lowers the amount of the nutrients that the baby receives. So for the mother, that also places the mother at risk for increased bleeding. Any substance use for the baby can cause placental abruption, placental complications, severe birth defects, and neonatal withdrawals. When a mother is using substances, this also places her at an increased risk of developing anemia, infection, and hepatitis. Next thing we're going to talk about is travel. So traveling is safe to do if you get your physician's approval, or as long as, I guess the best time to travel would be during the second trimester. Um, and that you want to run traveling by your physician to make sure that there's no complications during your pregnancy. Sometimes like sitting for a long time can lead to DVTs like in the lower extremities, and we want to kind of avoid that. So ways that we can avoid that would be kind of to move around. You want to wear compression stockings along with like trying to stretch and move your legs, or at least your legs for long periods of time. You don't want to be sitting down. It's also important to know that if you are going to travel, that you do know the signs and symptoms of DVTs, and that you make sure that you have adequate fluid intake. You want to make sure that you're staying hydrated. Like I said earlier, the safest time to travel would probably be during the second trimester. The first trimester, it puts you at risk for spontaneous abortion. And then during the third trimester, you can be at an increased risk of hypertension or preterm labor. To prepare for traveling, you'll want to know like your blood type, avoid any vaccines. You want to avoid any tropical islands or any underdeveloped countries. That's because you don't want to be put at risk of getting exposed to the Zika virus. And let's see, it is encouraged that you do see the dentist during your pregnancy. Like the same thing for traveling, the best time to probably go to the dentist is around your second trimester. It's recommended because as you're pregnant, you'll experience different hormonal changes, and you may be at risk of getting like certain infections. And this could be because of like your diet or your nutrition during your pregnancy. It might be different than your everyday day to day. So it also puts you at risk for like getting cavities, and we just want to get checked out. So you can get cavities, you can get fillings, you can get crowns, you can get anesthesia with epinephrine. You do want to avoid getting any x-rays. And then, like I said, getting it done in the second trimester would help you, because during the third trimester, we want to kind of avoid laying down for so long. It's just not comfortable, and it's not good for the baby because it constricts the oxygen as we get bigger. And that is it, I think. Thank you.